Welcome to the GlobalRPh YouTube channel. This study investigates the role of primary care in addressing the growing burden of anxiety and depression, particularly amid the shortage of mental health professionals. With demand for mental health services outstripping supply, primary care settings are increasingly tasked with frontline mental health care. The video analyzes the challenges primary care faces in meeting these needs and evaluates models designed to optimize mental health delivery within these settings. The mental health crisis has worsened, particularly post-pandemic, as anxiety and depression rates have skyrocketed. In the United States, an estimated 28.8% of individuals are affected by anxiety disorders and 20.8% by mood disorders. At the same time, the country is experiencing a severe shortage of psychiatrists, especially in rural areas. This shortage places an increased burden on primary care providers, PCPs, to manage a large portion of the mental health needs. The primary care system is now at the forefront of diagnosing and treating these conditions, which has blurred the line between general medical care and psychiatric care. Historically, specialized psychiatric care was the norm for treating these conditions, but with fewer mental health professionals, primary care providers are now playing an essential role. Projections suggest a continued shortage, making it clear that primary care systems must adapt to manage mental health effectively. This video discusses the structural and operational challenges primary care faces, including limited provider training and time constraints, while highlighting innovative models like collaborative care and task-shifting strategies, current challenges and capacity of primary care. Studies indicate that 40% of patients in primary care have significant mental health concerns, yet only about half receive appropriate care, often from their PCPs. Despite this, the workforce remains woefully insufficient to meet the demand. For instance, the psychiatrist workforce is projected to decline to 38.8 thousand by 2024, with a shortfall of between 14,000 and 31,000 psychiatrists. Geographic disparities exacerbate this issue, as many areas, especially rural regions, lack access to mental health services. As a result, PCPs are increasingly relied upon to fill the gap. Yet they often face a lack of adequate training to manage complex psychiatric disorders. Primary care provider training deficiencies. Current medical training for primary care providers in mental health is limited, leaving many providers ill-prepared to diagnose and treat anxiety and depression effectively. Most residency programs report dissatisfaction with the mental health training components, particularly in disciplines such as internal medicine, 71% dissatisfied, pediatrics, 85%, and obstetrics and gynecology, 92%. Without sufficient training, providers may lack confidence in their ability to deliver quality mental health care, leading to underdiagnosis or poor treatment management. Innovative models of mental health care in primary care settings. To bridge the gap left by the shortage of mental health professionals, several models have been proposed and tested. One such model is collaborative care, which involves a team-based approach to care. In this model, PCPs collaborate with behavioral health managers and psychiatric consultants to manage patients with mental health concerns. This integrated model has shown promise in improving treatment outcomes for anxiety and depression by providing more timely and effective interventions. Key tools such as the Patient Health Questionnaire 9, PHQ-9 for depression, and the Generalized Anxiety Disorder 7, GAD-7 scale for anxiety are widely used in primary care to screen for symptoms and monitor treatment progress. These tools support evidence-based practices, improving the accuracy of diagnoses and treatment outcomes. Task shifting, a solution for overburdened primary care providers. Task shifting, a strategy that involves training non-specialist healthcare workers to take on mental health care duties under the supervision of specialists, can further expand primary care's ability to manage mental health conditions. For example, trained nurses, pharmacists, and community health workers can provide valuable support in diagnosing and treating common mental health conditions. This approach has been shown to improve health outcomes, including blood pressure and HbA1c, while reducing costs. It has proven particularly effective in low and middle income countries, but can be adapted to higher income settings as well. Task shifting not only addresses workforce shortages, but also empowers non-specialist providers to manage mental health effectively within the primary care setting. Technology integration and digital tools. Advances in digital health technologies also offer a solution to scaling mental health services in primary care. Tools like telepsychiatry, mobile apps, and computerized cognitive behavioral therapy, CCBT, can enhance care delivery by enabling remote consultations and symptom monitoring. These technologies have shown promise in improving outcomes for depression and anxiety, though more research is needed to fully integrate them into routine care. Barriers to effective mental health management in primary care. Despite the promising models and technological advancements, primary care continues to face several barriers to effective mental health management. A lack of resources, time constraints, and inadequate reimbursement for mental health services remain significant obstacles. Patients, especially those in underserved areas, often face long waiting times for mental health services, making timely intervention challenging. Additionally, there is an ongoing struggle with integrating mental health services into the broader healthcare system. While many primary care providers report interest in offering mental health care, their ability to do so is often limited by systemic factors, including insufficient support and training. Economic considerations and cost effectiveness. Cost effectiveness remains a critical concern when evaluating models like collaborative care and task shifting. Several studies have demonstrated that collaborative care models result in faster improvements in depression symptoms compared to usual care, ultimately leading to better patient outcomes. However, the implementation of these models requires sustained financial investment in training, resources, and infrastructure. Research into the cost-effectiveness of these models, especially in terms of long-term savings and improved health outcomes, will be crucial in justifying their widespread adoption. Moreover, reforms to reimbursement models will be necessary to ensure that primary care can sustainably offer mental health services at scale. Conclusion: primary care providers are stepping in to address the mental health crisis, but systemic barriers must be overcome to ensure that they can do so effectively. Collaborative care models, task-shifting strategies, and technology integration offer promising solutions to this problem. However, to fully realize their potential, healthcare systems must prioritize the expansion of mental health training, improve coordination among providers, and invest in evidence-based care models. The future of mental health care in the U.S. will depend heavily on the ability of primary care to manage conditions like anxiety and depression effectively. This will require not just more resources, but a fundamental shift in how mental health services are delivered and integrated into primary care systems. Only through sustained commitment to these changes can the mental health burden be alleviated and the quality of care for patients improved. Thanks for watching our GlobalRPh production. If you enjoyed the video and found it helpful, don't forget to smash that like button and subscribe to our brand new YouTube channel. We're bringing you a dynamic mix of content across a variety of topics, so there's always something fresh, engaging, and insightful just for you.